Hello, hello. Good evening, everyone. Yes, so let's get started. Right. Okay. Good to see so many of you here. Good evening, good evening. Can hear me loud and clear? Put up your hands if you can hear me loud and clear. Is that okay? Can? 听得到吗
听到。
？OK，很好，谢谢。All right, so welcome to our LiCo book club. So what we do in the book club is every week we come together, we share about health, we share about fitness, and we learn together as a team, right? Of course, by learning together as well, we also remind each other of healthier lifestyle so that we can all stick to our healthier lifestyle so that we can all be reminded. Okay, so let me pull out my slides. All right, give me a minute. All right, okay, let's get going. Okay, so I see that there are many new friends here, right? There are many new friends today. So good to see so many of you. Let me introduce myself. My name is Jeannie. I'm going to be your nutritionist for today. And for myself, I've been in health and wellness industry for about more than 15 years now, right? Started with a diploma in diet nutrition, venture into also attended more certificate in nutrition, dietary supplements from Republic Poly in Singapore. I also get myself certified in training and performance for the adult, meaning I'm trained to, work with adults and to impart knowledge to adults. Of course, besides that, I'm also a certified personal trainer and yoga teacher. Working with Singapore Health Promotion Board to run events, to run activities, and also webinar. And today we're going to talk about osteoporosis. What is osteoporosis? Are we able to detect them early? And how do we even reverse them, right? So these are the important stuff that we would want to cover for today. And I would like to make this session less formal, right? If possible, if you have any questions, put it in the chat. Feel free to ask and we can discuss from here. So let me just quickly go through what is osteoporosis first. All right. Osteoporosis means porous bones. It's a condition when the bones actually reduce in terms of density. So if you see from here, right, the healthy bones looks like this. Okay, bones, we always think that it's a piece of bone, but actually it's not, right? It's made of a lot of bone cells that come together and they are breaking down and building every day, every time. Okay, so healthy bones, no matter how healthy, you can see that there are also some holes in it. It's not a whole piece of things, right? If you have seen chicken bones before, if you break the bone, you would see that there are bone marrow inside, and the bone itself is not just a whole thing. Okay, and what is osteoporosis bone? Osteoporosis bone looks like this on the right. So you can see that there are a lot more holes than it should be. When there are so many holes, the bone is actually less strong, right? It actually has a lot of hollow, a lot of holes, and if you were to hit, for example, a fall, a fracture, it can get hurt very easily. It can break easily. So that is osteoporosis. And osteoporosis, is it a normal condition? Some people tell me, Jeannie, is very normal, right? As we age, we tend to have osteoporosis, but it's actually a disease. Just like 2 weeks ago, we talked about sarcopenia, losing of muscle mass. That is also a disease, right? So as the disease progresses, as the person's bones getting more and more hollow, the risk of fracture increase. Even a slight bump, a slight fall can cause a fracture. Or even worse, I'm sure you also have heard of people who, after a fall, not just they fracture the bone, but the bone actually like crush into pieces, which makes recovery very, very difficult. So this is especially a condition as people age, as we age. All right. So some early sign of osteoporosis, there might not be much sign. It's a very silent disease actually. Right? We might not feel anything. You don't feel any sore pain or any discomfort when the bone density is going lower and lower. Right? There is no sign. The only time that happens is when there's a bone break. When the bones break, then you know that this person is at risk of osteoporosis. Okay, so what happened? Why is it so important to take care of bone health? Why is it so important? So what happened is that if someone fall, right, a person above 60-year old, if he were to fall and fracture the pelvis, which is the bone by the side of our hip, right, there is a more than 40% risk that this person doesn't survive in the next 12 months. The person is there's a 40% chance that she will not survive in the next 12 months. So the mortality rate is pretty high. And even if the person survives after 12 months, likely more than 25% of them, that means 1 in 4 of them, will not be able to go back to their usual movement, usual mobility, meaning they are not able to walk, carry things, do their day-to-day activity like what they have been able to done before. So that is why it is important to keep our bones strong. That's number one. Of course, number two is to be careful when we move around as well, to prevent fall and to prevent any fracture. Right? So these are some of the important things that we want to take note for osteoporosis. If you have any questions, okay, at any point, please put it in the chat. I might not be able to answer you right now, but we can discuss after that. So any questions that you think of, all right, just put it in the chat so that we can make the discussion a bit richer. We can all learn from each other. Okay, so bone is a living thing. It's a living tissues. It's growing every day and it's also breaking down every day. Okay, so the new ones, the wear out ones, they will die off and then the new one will actually be built. So to keep this cycle, our body needs calcium. So we know that 60 to 70% of bone is made of minerals, right? It's the place in our body that has got the most minerals. Calcium is one, phosphorus, magnesium, these are all the minerals that needed for bone building. And the second thing that we need is to have the sunlight. So we know that calcium, sunlight will help to build the bone, to help with the bone remodeling, especially as we age. So what happens is that there's osteoblast and osteoclast. Okay, so there's two things happening at the same time. One is the bone has been building. The other side, the bone is actually deteriorating and actually falling apart. So we want to make sure that the building state at least can keep up with the state that the bone is falling apart, to keep the strength of our bone, to keep the density of our bone strong. Okay? So how to do that? So imagine our bone is the calcium bank. It's like you keep money in the bank, you keep the calcium in your bone. So during our growing up years, usually starting from before puberty, about 8 years old, you can see these are the two lines in the chart. Red one is the female, blue one is the male. Right? Male and female start at about the same. About 8 years old, they start to jump a lot, move a lot, and start to build bone mass. So you can see from 8 to after puberty, which is about 20 years old, both male and female, girl and boy, they will grow up very quickly, right? Grow up and also become stout, build up in terms of their bone density. This is the time that they can build up very much. And when do they stop building up? They continue to build up until at the peak bone mass will be at about, you can see this is from 10 years old. So from here, it's very strong, very sharp growth here. This is puberty. This is, x-axis is age actually, right? And then bone mass is at a y-axis. So you can see that from 0, it grow up very slowly. From 10 during puberty, it will spike up. And the max is at 30 years old. Okay, so many research has done that max bone or the maximum that you can keep your calcium or calcium savings is at 30 years old. Okay, how many of you here who is below 30 years old here? If you're below 30 years old, then congratulations. Today, I just consulted a lady. She's only 28 years old. So she still have time, right, to keep the calcium savings. But after 30, what happened is that male and female has got a different height, different amount of bone mass. By nature, guys will have a higher bone mass, but you can see that the guy's bone mass also going down after 30 years old. And old age sets in scientifically, it says after 70, the guy, you will see a big reduction in bone density. Okay, as for ladies, you can also see the slow progression of coming down, but at menopause, this is this big jump down. There's a big decline during menopause, and then slowly it just go downhill for old age. So the difference between male and female, why we have many more female having risk of osteoporosis is because of these two reasons. Number one, by nature, by the build, women tend to have less bone mass to start with. And number two, the deterioration is not just slowly, progressively as we age. We see a big jump during menopause. That's because of the big reduction in estrogen that asking the body would actually break down more bone mass than it's building up. That's why you see the drop here, right? And then it will go downhill from there. So having said that, plotting the chart to 70 years old is not even enough, because average expectancy for Singapore is already 85 and for Malaysia is 76. So now we are living longer. That means, right, we need our bones to work for us a lot longer than before. So imagine last time, 30 years ago, life expectancy is only 60 years old. It's only 55, 60 years old, right? That's why there's not so much issues of osteoporosis. But now, as we need to live longer, we need the bone to support us longer and hopefully doesn't reduce so quickly, right? So that we can still have our mobility. So this is another chart, same thing from 0. This is a male, will go up at about 30, peak, and then it will slowly, steadily go down. Okay, whereas for women is here, go up to about 30 as well. It will slowly go down, and at menopause, it will drop down like this. So you can see this light gray and dark gray area. Light gray is low bone mass. We can call this osteopenia, right? And once it go into the gray, dark gray scale, it's already osteoporosis. Okay, so if this person has suboptimal lifestyle, meaning at young already not taking enough calcium food, not doing enough exercise, not building enough bone mass, even at 30 years old, when the bone mass decline, it's very fast. It could be up to 50, 55. This lady already going into osteoporosis and having a high risk of fracture. High risk of bone fracture. So we've seen clients with a simple fall like that, they actually fracture their bone, and because of that, they are not able to walk anymore. So that's quite sad if this happen. And of course, if you go to the hospital and visit anyone, you will see you look left and right on the bed. Often the elderly, they have this sign with a coconut tree sign. Any of you seen the coconut tree sign or not? Put up your hand. The coconut tree sign is actually a fall risk sign, meaning this elderly or this person has a risk of falling. So we have to be extra careful to take care, to move this person because the high risk of fall. Okay? So that is why we want to take care of our bones. And the most common area to fall is the hip, from falling backwards. So if the person doesn't have enough core strength, when we walk, right, usually walking up is okay. Walking down we need our body or core to actually break, right? To stop ourselves from going when we are going downhill, for example. And if there's any slip and the core is not strong enough, often the person fall backwards, meaning sitting down, right? Sitting down on the floor can land the hip on the floor and that can cause hip fracture. So this is what I said just now. If the person above 60 years old has hip fractured, more than 30-40% of them could not survive for the next 12 months. And even if they survive, about 25% of them cannot go back to the usual activity like walking, go for marketing, etc. That's simple activity. And risk is the second one. If you fall forward, then you'll be have a risk of fractured, which is here. All right. So these are all the risky areas. Okay. So what makes our bones strong? Okay, life cycles of bone, we know that at 30 it will peak. After that, it will slowly go down already. So what actually gives us the risk of osteoporosis? That's right. Genetic is one. So if your family, if you look around your parents and your grandparents, if they have a fractured before, especially at a young age, fractured, fall and fracture at a young age, that increases your risk as well, because that is genetic. Of course, different race, ethnic level has got different percentage as well. So that is okay. And the second thing would be our diet, of course. So if you feed the body with the right food, our body will be able to deposit more calcium into the bones and we will have a higher peak. And slowly, even when we deteriorate, you don't have to worry so much about it. Okay? And of course, the lifestyle, activity. So what are the activity can help to keep our bones strong? That's why you see a lot of kids, right, since young. Most of the kids, they don't walk, they jump, right? They jump, they're bouncing, all around because these are the movements that can really stimulate the bone growth. Okay? Unfortunately, walking itself cannot stimulate bone growth. Okay, it's just walking. That's why we need some jumping, we need some weight loading in order to keep the bones strong and working. Okay, so consuming calcium-rich food is important. So whenever people think of calcium-rich food, they will tell me milk, milk, milk. I think that's because of the advertisement, right? Last 30, 50 years, there's a lot of advertisement on milk to link it to calcium and to link it to strong bones. But you can get calcium from plants as well. So where does the milk, where does the cow get the calcium? Okay, like all the minerals, calcium, magnesium, potassium, all the minerals only exist on the ground. Okay, on the ground, in the soil. Okay, so Mother Earth provide us with all these minerals. So the cow eats the grass and produce the milk, right? But then again, nowadays, a lot of milk are actually commercially farmed. Right, the cows are commercially farmed and the milk are actually commercially produced. A lot of the calcium is actually not natural from the cow, but it's actually fortified, meaning it's artificial calcium added into the milk. Okay, so if you buy a pack of milk next time, you can look at the ingredients, you can read the ingredients. Usually it says that it's fortified with calcium and vitamin D. Right, so we can look at that. So calcium-rich food will be the deep leafy vegetables. You can take all the deep leafy vegetables that give you good calcium content as well. And then, of course, exercise helps to build strong bones. Smoking can cause bone to lose its bone density as well. I'm not sure if you noticed this actually. So research shows that the never smoker has got the best bone density, right? Taking away all the other factors. If you have never smoked before, your bone density will be here. The late smoker, meaning those who start smoking after 16 years old, will have lower bone density. And the one that has got the worst bone density are the early smokers. What does it mean by early smokers? These are the people who start to smoke even before 16 years old. Okay, if you have friends who are early smoker, they say that, 16, 17, they already start smoking, but they might have quit smoking for the last 20, 30 years. Still, they are of high risk of osteoporosis. Just because when the years that we are building up our calcium, the smoking actually deter the absorptions of calcium. Okay, what else can deter the absorption of calcium? Anyone? You can put it in the chat if you know. Do you know any things that can deter the absorptions of calcium? Okay, so one thing that can deter, another thing that can deter absorption of the calcium would be the use of certain medication, especially steroid medication. Okay, so if you have friends, you have family members because of maybe skin issues, eczema, or because of other disease, they're using steroid on a long-term basis, that would affect the absorptions of the calcium as well. People with thyroid issues, because thyroid is here, it's like a butterfly, right, behind our throat. And behind the thyroid glands, or on top of the thyroid glands, there's this parathyroid glands. The parathyroid glands is responsible for absorption of calcium in our body. So if there's any thyroid issues, hypo or hyperthyroidism, often the doctor will ask you to check your calcium level as well, because that might affect the parathyroid glands and affect the absorption of calcium. If the calcium absorption is low, then the risk of osteoporosis will be high. Okay, so you know that you might have certain risk factor. For example, you might not consume enough calcium-rich food, you might not have enough exercise, and of course, if you're not smoking and no caffeine and alcohol, that's the best. And how to test and when to test. So we usually use a BMD, bone mineral density test, to detect osteoporosis risk. Okay, so when to do the test. How many of you has done this test before? Again, you can put it in the chat if any of you has done the test before. Okay, phytic acid. Okay, phytic acid also affect the absorption of calcium. That's to do with your food combination as well. So if any one of you has done your bone density test, you can also share here. Okay, so that we can all learn from you as well if you've done it before. Okay. All right, so if you've done before, you can share here and then we can read your result as well. You can put it in the chat, you can, upload in the chat, or you can WhatsApp to me. Later I can discuss with the rest. Okay, so consume calcium-rich food is the most important thing and the easiest thing. Although some of you, like myself, might have been over 30 years old already, but do you have someone in your family that's below 30 years old? Have or not? Should have, right? So if you have, this is also important information. Make sure that your family members eat calcium-rich food so that they can build stronger bone mass, especially for those below 30 years old. Okay? So getting enough calcium, it helps you to build your bone mass from childhood right up to your very old age. Okay? Until 30 years old, you make dense and stronger bone. Beyond 30 years old, yes, the research shows that we might not be able to increase bone mass further. But taking enough calcium every day will continue to provide the right nutrients to the bone for it to continue to build back. So because we know that after 30 years old, the body tends to deteriorate more than it can build, or the bones start to break down more than it can build. But the building part, it is still building. Right? It's still important to give it enough calcium, enough raw ingredients for it to build so that the reduction can be more gradual. Okay, so that we have less risk of osteoporosis. Okay, so how much calcium do we need on a daily basis for children? For female, generally need more than male, right? Especially pregnant women who are pregnant and lactating moms will need about 1,006. Minimum we need is 1,002. Okay, 1,002 mg of calcium per day. So this is the serving size. For example, if you take low-fat milk, a glass of low-fat milk will give you a 380 mg of calcium. Okay, a canned sardine. These are some of the things that I would strongly recommend you to take more. For example, canned sardine with the bones. Eat one fish with the bone, will give you 270 mg of calcium. We need about 1,002. But, if you can incorporate 1-2 fish of canned sardine into your diet, it'd be really good. Try ikan bilis. Again, eat it with the bones. Calcium is in the bone. That's what we can do. Tofu, tau kwa, dal. This one has got some calcium content as well. Baked beans also give us some calcium. Whereas for vegetables, you'll be kailan, spinach, trisim, broccoli. Right? These dark green color vegetables are richer in terms of calcium, not the white color vegetables. The white color vegetables has got mainly water, right? Less of the minerals. Okay, and of course, you can go for calcium fortified products as well, like calcium fortified bread. Is by law that Singapore bread, all those gardenia, kind of bread, need to be fortified with calcium. Okay, so you can take the enriched bread, you can take the high calcium soy milk or milk as well. For me, I truly recommend you to take from the natural food. The natural food will be here: sardine, ikan bilis, tofu, tau kwa, baked beans, and also dark green leafy vegetables. Try to incorporate 1 or 2 portions in your daily diet. Take them every day, because the bones, you need that to build the bones every day. It's not a one-off thing. Okay, so vitamin D is also important because it helps the body to absorb calcium. So we see a lot of elderly is a challenge because they don't go out at all. Even if they might eat tofu, they might eat ikan bilis, but it's not being absorbed and used in the body. So you need about 20 minutes of sunlight every morning. The best way to do is every morning, early in the morning as you wake up, go for a walk outdoor for about 20 minutes. So try not to cover everything, sunglass and everything. Just take out your clothes. No, sorry, not take out your clothes. Just wear lesser, maybe just a t-shirt or stripe, then get the sunlight exposure, especially at the back, right? Get some sunlight towards the back so that it can help you to absorb the calcium. It's important, okay? And of course, having sunlight in the morning can also help to adjust our circadian rhythm, meaning tell our body that, hey, it's morning already, please wake up, okay? And by night, we'll be able to sleep better, we'll be able to sleep well. Okay, and of course, exercise that can help us to build stronger bones would be weight-bearing exercise. It's not just walking, right? It's not just doing stretching, and all that. But you need to load the bone with some weights so that it knows that you need to make use of it. It can grow stronger. So one is plank. Plank is a very, very good workout that you can just do either elbow plank or just forearm plank or just plank like this. Just hold it for 30 seconds, 3 to 5 sets a day. You don't have to do for very long, but by doing this, keeping your core tight, you're actually telling the body that, especially upper body, that I still need to carry my weight. Okay, so continue to stay strong in terms of the bones. Okay, hip glute bridge is another one. Glute bridge is another one. Just lie down and then step tight onto the floor and bring your hip up and down. Just do 10 to 20, 3 sets a day. Right? These are the simple ones. If you can do 3 to 5 times a day, about 20 to 30 minutes each, a few exercise that will help to maintain stronger bones. Okay, so you can do outdoor, you can do simple workout at home, start slow and rest and recover. If you already have some health issue, can of course talk to the doctor first. And myself, a few of our coaches here are also fit trained, meaning we are also trained in terms of physical activity. So if you have any questions like how to do squat, how do you want to do certain workout, please check with us. And if you think that we can have workout sessions like this, I can demo some workout for you, then you can do together on a Zoom. You can also let us know. We can arrange for that as well. Okay?
Let's do 12 together.
What
Let's
we
go.
want is really,
1,
this is like push up,
2,
all the way down,
3,
all the way up. This is one-legged push up,
4,
just to work on the upper body,
5,
especially for ladies. you might do jogging, running, Zumba. Upper body strength, usually we are lacking. So push-up is a very good one, which we coach on a weekly basis. So if you want to join our weekly workout on Zoom, also put it in the chat. We'll share with you the link. All right. So this is this. And of course, quit smoking if you are still smoking, because that will bring down our bone density as well, and limit alcohol and caffeine. Because alcohol and caffeine are what we call the nutrients robber. If you take calcium food together with alcohol and caffeine together, alcohol and caffeine will deter the absorption of calcium. The body will not be able to absorb calcium so well. So the nutrients that you eat will be wasted. All right, so try not to do that. Okay, and identify your risk of osteoporosis. For example, this is weight. If this person is okay, so high risk people are this. Number one, female. Sorry, male and female, we don't get to choose. So female is for high risk. Number two, if you are underweight, you are of a higher risk. Okay, so underweight has got a higher risk, and of course, age. As we age, the risk gets higher as well. Okay, so for example, if you are female, you are only 45 or even below 45 kg, even at 40 plus, you will be at risk of osteoporosis already. Okay, if we have a bit higher weight, then you will be of a lower risk. Okay, and how to test a bone density? This is a BMD test. BMD test is the industrial standard. You have to lie down like this. Then you go through a machine. They use two very low dose X-ray machine to check your bone. Okay, to take an impression of your bones, and you can understand exactly how your bone density is. Okay, so to do this, usually in Singapore, the recommendation is only 60 years old. 50 to 60, then you go and do your bone density test. But for me, I think if you already know that you've got family history of that, you're female, you're of a smaller build, you are underweight, you can actually do it earlier. Just at 30, 40 years old, just do a bone mineral density test. It's very simple, okay, and it's not expensive as well. Okay, especially for ladies, if you are going into menopause, like 45 years old to 55 years old, or ovaries have been removed, meaning our estrogen level, okay, spelling here, estrogen level reduced. So it's good to do a test. Okay, above 50 years old, going into perimenopause already, have weight loss, have lost height over the years. So some friends tell me, last time when I measure, I was 1.65. Now I'm only 1.62, 1.63. What happened? I've gone shorter. So if this happened to you, also you want to do a bone mineral density test to make sure that you know your condition so that we can do something about it. Right? Thin, small frame, lighter, smaller bones. Okay? Seldom take milk or milk products. Seldom take milk, cheese, yogurt. Don't really like drink dark leafy vegetables. Don't like to eat sardine, right? So all this you might risk not having enough calcium in the diet, and lack of physical activity. Those who seldom exercise, you may also want to do the test to make sure that you're okay, right? Of course, those who smoke, those who drink a lot of coffee, tea, and alcohol regularly. So my experience, myself, I love to drink tea. Okay, I drink Chinese tea on a daily basis. Sorry, as I'm speaking, I'm drinking Chinese tea. Okay, so when I reached 50 years old, okay, I quickly did my test already. I quickly went to do my BMD test. I'll share the result with you later. Okay, so if you have family members with osteoporosis or hip fracture, you might want to do the test a bit earlier on prolonged use of steroids because of whichever issues, have been immobilized for a long period of time. So, for example, you might have injured yourself before, bedridden for example, 3 months before, or under hospital care for a while, right? So, when you recover, likely because of lack of use and malnutrition, your bone density might have been lower as well. So you want to get it checked. Have a previous fracture due to fall, have an eating disorder, okay, anorexia or bulimia. These are quite a rare case, but this could happen. If you have any of this, you might want to talk to your doctor to do a BMD test. For myself, because my love for drinking tea, right? And at 50 years old, I did a series of health check as a 50 years old gift to myself. Okay, so I went to do let me share with you. I went to do my BMD test. Okay, so BMD test looks like this. Mainly, they look at two areas. One is your bone, okay, L1 to L5, and number two is your femur is here, lumbar spine and the left or right femur. So why these two areas? I think these are the two main areas that are subject to injury, right? A lot of people tell you if they have back pain, you have the back issue, is usually L1 to L5 or L4, L5 to be very specific. So the test is done on this area. And the other one, of course, many will have risk of fracturing our hip bone. Okay, so this is the left femur, the neck here is prone to injury, fractured if we fall at this area, right? So the thing, okay, did the test and I've got the T score and a Z score. Okay, this is a T score. So what is a T score? Right? Let me explain to you whether it's good or bad. But I think you can see from here, of course, anything to do with green is very good. Blue is okay. And then yellow is osteopenia and red is osteoporosis. Okay, you don't want your numbers to go below or your dot to go below into the low area. Okay, so this is it. And then this year I went to do another one. So same thing, doing the same test, and I've got the T score and the Z score here. So I want to share this with you as well on how to read the T score and the Z score, right? Give me a minute. All right. So what is a T and a Z score? This is actually standard deviation. If you still remember your statistic, standard deviation actually rank all the people on a bell curve, right? So bell curve, and then 50% of people on top, 50% of the people below. This one, it takes the bone density of everybody and then to rank you like a bell like this. Okay, so T score. T is to compare you with a healthy adult of 30 years old. 30 years old. Okay, so rank you and then put you in the T score. So you know T score is actually a standard deviation, right? Standard deviation. So what does it mean by a T score of 2? A T score of 2 meaning compared to a 30-year-old healthy adult, I am ranked, this bone density is at the 97 percentile. 97 percentile. So it's higher than 97% of the people. For 97% of the 30-year-old people. Okay, so as we age, we cannot compare ourselves to the 30-year-old anymore, right? So we compare to people of our age. So this lady, 54 years old, we have to compare with all the people, same race, same female, 54, and put them in the standard deviation again. And the Z score is 2.9. 2.9 would mean that the bone density is better than about 99% of people of the same age. Okay, so this is what we aim for. Was that higher? No. Standard deviation only up to 3. It's 0, 1, 2, 3. Okay, so if your number, for example, is -1, that means you are below the 50 percentile. Okay, your bone density is actually only higher than about 15% of people of your age. Okay, this is a bit technical, but let me see if this can explain to you better. Okay, so T score is to compare yourself with the average healthy young adult aged 30 years old. It's when the bone mass is at its peak. Okay, so if you're normal, this is what it says. If you're more than -1 is considered normal. Osteopenia is -1 to -2.5. And osteoporosis -2.5, you are already at the very low level, less than 3% of the population. Less than 3%. You're the lower 3%. Okay, Ken? And Z score is compared to people of your same age. Okay, so doctor usually look at the T-score to see whether there's any osteoporosis. So what's the difference between osteopenia and osteoporosis? So that's the next question that I usually get. Osteopenia, we are saying that your bone density is about 10% lesser already. 10%. And if it's 25% below, it's considered osteoporosis. If you want to understand it simply, it's like this. Okay, that means the bone density is getting lower and lower. There are more holes within your bones. Okay, can, right? So, and it's a natural progression. Number one, if we don't do anything about it. Okay, if we don't do anything about it, it's a natural progression that our bone density will go down. But we need to do something about it. Okay, let's do something about it. So number one, what we can do is when we eat our meals, okay, constantly look for bones. Eat the bones. Sardine, ikan bilis. These are the good ones that we can eat. Tofu, tau kwa, dal, these are all good stuff as well. And green leafy vegetables. We include them in our daily diet. We should be better in terms of our calcium intake. And of course, number two, sunlight. Make sure that we have 20 minutes of sunlight exposure and weight-bearing exercise. Try to go for weight-bearing exercise at least 2 to 4 times a week. Right? For my clients who don't take enough calcium, some friends tell me that, give me a minute. They can't, in their daily diet, they are not able to. Okay, so some friends actually tell me that in their daily diet, they're not able to take in enough calcium. Right, so this is when I would recommend them the calcium supplements. This is the calcium supplements that I use for my clients. It's called Neutralite Calcium Magnesium D or CalMag D. So by taking this, every 3 tablets will provide 600 mg of calcium, which is half of what every woman will need on a daily basis. So if you don't take enough, this will give you at least half to support your healthy bones. It's better absorbed because it's got also D vitamin added. So 399 IU of vitamin D for 3 tablets. It helps with the absorption of the calcium. And the calcium is made of calcified seaweed, meaning it's from natural botanicals as the source of calcium and magnesium. Magnesium also helps with the absorption of calcium as well. So these 3 things work hand in hand to help with calcium absorption. Calcium, magnesium, and vitamin D. So this will help to fill the dietary gap. If you think that, you are not taking a lot of fortified calcium food on a daily basis, this definitely is something that can help you. And for myself, because I love to drink tea so much, I will take at least 4 tablets of this calcium magnesium D on a daily basis. 4 to 6 tablets actually. After exercise, I'll definitely take 2 because we know that after exercise, especially after weight-bearing exercise, is when we strain the bones, we need to give it the right ingredients to build stronger bones. So I definitely load in the calcium, magnesium, and D. The other thing that is very important for bone density is protein as well. Right? So on top of having sufficient protein, this would be the supplements that I do, all plant protein, to add on to my protein intake as well, to keep my not just bone density, but also muscle density, right? We talked about muscles 2 weeks ago, so this is also very, very important. If you don't know your bone density, if you like to know, for example, if you have any of this, risks, if you're in Singapore Okay, let our team know, let the person who invited you in know you are in for a free bone density ultrasound. This machine, you can just put your leg in, and we are using an ultrasound technology to detect and to see how is your bone density. Okay, we are providing you for free if you want to understand more about your bone density. So on top of that, you also get your in-body composition analysis. You get a creep test to test the sarcopenia, like I explained to you 2 weeks ago. We do our bone density ultrasound, diet and nutrition consultation, and our blend sample as well. Okay, this is the complimentary LiCo Health and Wellness Assessment that we provide for our community so that we can all come together to understand our baseline, to understand our bone density, and to see how we could actually be better. So number one, get enough nutrients, calcium-rich food, exercise regularly, quit smoking, reduce the intake of alcohol and caffeine, and of course, assess the risk. If you have the risk, please do the test first, just to know where you stand so that we can put in the right measures to improve and to reverse it. Okay, can osteoporosis be reversed? Yes, it can be. We can still build our bone mass regardless of our age by eating the right food, by doing the right exercise. Okay, so from here, okay. Yeah, okay. So from here, I'm just going to stop sharing. Dear. Sorry, a bit hang again. Right, let me see if there's any questions. If you have any question, please put it in. And if you have done any of your bone density, please share in the chat, right? So that we can also take a read and explain to you what that means. Not able to stop sharing. Can one of the co-hosts help me here? My screen is actually freeze. Can one of the hosts help me to take over? Stop share. Just stop share. Can? Hello? Can you still see? Can help to stop share, please?
I'm trying but cannot. Let me see, I share my thing.
Yeah, you try to see if you could break it. Because my side actually...
I share my screen, then I only can stop my own.
Okay, what do you see? Do you see me sharing screen now?
Yeah.
You still see my share screen?
Yeah, your slides, yes. It's fine. Okay, wait, let me see it. Let me see if I can replace you.
All right. So, and the rest, if you have any questions, please put in the chat first, yeah? We have the last 10 minutes of our webinar. Okay, now I have got this. Okay, be able to see now.
Okay,
Okay,
I done.
good. Right. Thank you. Sorry about that. Let's look at the chat. I am not able to click the chat. Okay, how frequent do we need to do a bone density check? Okay, so Patrick asked how often do we need to do? If you have not done it before, if you have any of the risk factor, I'll suggest you just do one first. You only need one every 3, if your bone density is okay, you only need one every 3 to 5 years. That's why I only did my second one after, how many years? 5 years actually, yeah. Right, so you don't have to do it very often. And 5 years, and now you just do a comparison and see if there's no big deterioration. I think that would be good. I'm not able to click on the chat as well. Can someone help me? And
Okay.
if there's any chat,
Is
yeah.
a cup of coffee a day too much for an osteoporosis patient?
No, a cup of coffee is okay. It's definitely okay. 1 to 2 cups, there's no problem. Just that you want to separate your drinking of coffee with consumption of high calcium food. So that if you eat a hearty meal with your tofu, with your ikan bilis and all that, you don't take it when drinking coffee. You drink your coffee 1 hour after your meal, so that the body has time to absorb the nutrients first, then only enjoy your cup of coffee. Yeah.
Okay, which affect absorption of calcium more? Caffeine or medication or alcohol?
Wow. I don't have an answer to this. Does it mean that if affect less, you're gonna do that? No, right? So I think it's adding up. If you're already on medication, uh, if that is inevitable, try not to do the alcohol and the caffeine already, lah. Right or not? Makes sense, right? So if you have less, I think the best is really to understand your current condition first. If your current condition is okay, for example, if you are 40 years old, you're a lady, okay, and if you go and do a bone density scan and your bone density is already showing you a negative, like your T score and D score is already negative, meaning you're already lower than usual, right? Then you might be very careful. You might really want to change your diet and your nutrition, add on calcium food, cut down caffeine, alcohol, smoking, etc. Because before menopause, if the bone density is already low, I'll be very worried for you after menopause. Okay, so if you're after menopause, if you're already 60 years old and you've been drinking coffee and you go for your test, you see that your T score and Z score is still okay, within range, then you don't have to worry so much. Just make sure that you continue to take high calcium food, take enough protein, right? Then you should be fine. So it really depends on where you are also in your stage of life, but always understand your current condition first. Then that have we been doing the right things all along, and what can we do to improve on it, right? So you're in Malaysia, if you're in Penang, if you are in our Tai Chi group, right? So if you have any questions, if you want to understand more about your bone density, want to do a test, you can put it in the chat also. Hui Kim, right? Our pharmacist here, Hui Kim, will be able to assist you with that as well. And for those of you who are in Singapore, of course, we are providing a free bone density test, an ultrasound test at Apira Mall. So do let us know. Let the health coach who invited you in know, whether it's Liz, LiCo, Pat, Gladys or myself, and we'll be able to bring you for that free test. Any other questions?
Yeah, it says, sorry, there are different types of magnesium such as citric, glycinate, etc. What are the differences between them and how do we choose the right one? How much dosage do we need? So the different type of magnesium.
Right. There are different types of calcium, magnesium, because those commercially produced one usually is artificially made, and it comes with different combinations or different form as well. So I think the research is not really very clear as to this is better or that type is better actually. It also depends on the body, whether the body is able to absorb or not. So the best is still, after you do a test, you know where you stand already. You can just, when you choose your supplement, the most important thing is choose the supplement with natural ingredients, right? That's why I'm using Nutrilite. Nutrilite has got fortified seaweed, is made of natural ingredients. So natural ingredients, number one, the body will be able to recognize it and absorb it better. Number two, even if it's not absorbed, it's easy for the body to get rid of. It would not burden, like what we always concern if we take too much artificial supplementation, burdening the liver and the kidney. That's the last thing that we want, right? So I don't have the research into the specific form of calcium or magnesium that has got the best absorption. I can read more if you put it in one of the community chat. I can read more and answer you, but I don't have an answer now. But the general, I think, and the most important thing is choose a supplement that is naturally made, has got natural ingredients.
Okay, the last question is what is the risk of taking calcium for a patient with artery blockage? Artery, is there any risk of taking calcium for a patient with artery?
Okay. I think you might have thought that the calcification of the artery is because of taking of calcium, is it? Okay, so some people with heart disease or artery blockage, the doctor will say that, oh, you see that there's some blockage here in your artery and there's some calcification. This calcification has got nothing to do with the calcium that you take in your diet or the calcium supplements that you take in your daily consumption. This is actually because of usually the blockage is because of the cholesterol formation, right? And inflammation around the artery. And to protect the artery, the body actually would slowly use a plaster, a self-produced plaster, usually is made of cholesterol, to plaster through the inflammation or to plaster through the injury in the artery. And that over time would be hardened, and that's what the doctor called it calcification. This is not because of the calcium that we take in our daily diet. 两回事, two different things. Yeah. So taking calcium supplements will not affect or will not harm any of the patients with heart condition or with artery blockage. Right? If any of you who of course I think Hui Ying will know better. We give our pharmacists here. If you have any points to add, please feel free. This is from my understanding of nutrition. Yeah. Any other questions? Okay. Hui Ying said okay. She approved of my answers.
Hello, can I ask a question?
Yes. Lancy.
How about polio jab? Polio jab.
What is that?
Oh, it's a jab that I was advised to take every 6 months.
Oh, to help to keep your bone density level.
Yeah, bone density. Yes.
Hui Ying, you might be able to answer these questions. I don't really get into, so much into the pharmaceutical side, as to the pros, cons, or any side effects of that. Because for my training or, practice is usually really through diet, nutrition, and lifestyle to improve this.
I see. Okay.
Yes.
Sorry, sorry, I lost my voice.
Okay.
I also not really clear about polio jab because this is not my professional as well. So maybe I need to find more answer. Then maybe can you leave your phone number? Then we reply you later.
It's okay. It's okay.
Yes.
Because
Depends on
I was
which-
advised by the endocrinologist to take it because firstly I'm a thyroid patient and I do take the bone density test every 2 years. Every 2 years to see whether the polio jab is effective or not on me. Yeah.
Is it effective so far?
So far, she said it's effective, but I just want to know
You know
whether
how
is
to
it
read.
all right.
You know how to read your T-score and Z-score or not? If not, then you can just let us know in the chat. Are you in the Tai Chi community or in LiCo community?
No, I'm from Penang.
Yes. So you
Yeah.
can just share, you can let Hui Kim know their report. She can help you to take a look. And for us, really, in our community, we try to work on diet, nutrition, and lifestyle to help you rather than rely on medication. Yeah.
Yes, I
Mm,
understand.
yes.
Thank you so much.
All
Thank you,
right.
Jeannie. Yeah.
Yes. Any other questions, anyone? Right? If not, for those of you in Singapore, we're going to have our walk, our LiCo Fun walk on this Saturday. Saturday morning, 8 o'clock, we'll be at Botanic Gardens. So we'll be meet at Botanic Gardens MRT. So we go and walk together. Next Tuesday, we won't have a webinar. So we'll resume in 2 weeks' time our LiCo book club. We will update all the activities in our community. So if you're in our Tai Chi community or you're in our LiCo Wellness Lifestyle Connect community, do let us know if you have any questions, any feedback, and I'll see you again if you don't have any other questions. Right? Thank you very much.
Thank you.
Thank you.
Bye
Bye-bye.
Thank you. Bye-bye.
Thank you,
Bye.
Jeannie.
Thank you.
Should I leave or are we going to continue again?
We will use a different link.
So I leave, yeah? Okay, thank you.
I also cannot end.